Hey everyone. So it has been a while since I have done a pregnancy update. So I just wanted to get on here and give everyone a quick update. A lot has happened in the last week and a half or so. Um, I am 22 weeks and 4 days, I believe, today. Um, so last week, I started experiencing a lot of contractions. Um, they were pretty intense and they were not going away. Um, Now, they were not, I didn't think that they were anything to be concerned about because there was no pressure along with them, definitely no bleeding or anything like that. And they weren't really all that painful, but they were pretty strong and they were just not letting up. So I was having lots and lots and lots of them. In addition to that, I was having a lot of pain that I would describe as like cervix pain, sharp pains. It's the same pain that I experienced with Caroline when I was pregnant with Caroline, and it was right before I was put on bed rest, and I was told I had a short cervix. So that also kind of concerned me. So I think that was last Sunday, and it was just getting worse. And so on Monday, I finally decided to call in to my doctor and just see like what they wanted me to do. Because my tactic of resting and hydrating was just not quite getting me to where I needed to be. So they said, based on your history with your first pregnancy, you should probably go into labor and delivery. So Monday night, we went in, Monday afternoon, evening, I guess I should say. We went in. Of course, when we got there, my contractions subsided because that's what happens. So they had me all hooked up and they were like, well, your uterus looks very irritable, but we're not seeing a lot of contractions. So whatever that means, they could tell that it was irritable. The good thing was that William was moving around a ton. His heartbeat was great. He was very active, so those were all really good signs. So after talking with the doctor, they decided to give me some IV fluids. So they gave me 2 liters just to make sure I was good and hydrated. So they did that, and then they were pretty much ready to discharge me, and all of a sudden the contractions came back, and this time they were very painful. So it was the first time, that they had actually been painful contractions. My back was hurting. It was like back labor contractions. They were very painful. So they said, they were like, it might be because we just filled up your bladder. So they had me empty that out a few times, but it was still pretty bad. And they were happening I think it was every 3 minutes that they were recording, and they were lasting, a good 30 seconds, that's what had been happening at home. It was very consistently like every 3 to 4 minutes, and they would last about 30 seconds, 25 to 30 seconds, but they were not painful. So now I was in the hospital and they were painful. So that was kind of concerning to me. So anyways, when they were talking to the doctor on the phone, the labor and delivery nurses, they were instructed to give me terbutaline shots to stop the contractions. So they give them to you like right in the back of your arm. They are very painful. They gave me 2 to stop the contractions. It's also a very uncomfortable shot, just the effects of it. Your heart rate spikes way up. I was up way over 100. I was shaking all of a sudden, and it's normal. They said to expect that, but it was very like your body just is jittery and on edge all of a sudden. But it did stop the contractions. So after 2 rounds of that, they sent me home. So it was a long night on Monday. We were there, I think, from like 5 to 10, I would say. And Caroline was such a trooper. She was really patient with being there, and it went as good as it could have gone. So anyways, so they sent me home, told me to keep an eye on things. And, the next day, of course, the contractions were still happening. So I called in and wanted to check on what they wanted me to do. Luckily, I was able to get in and see my specialist. So that was super, super kind of calming for me just to like touch base with him. So he checked everything, did a very thorough ultrasound on Wednesday and checked my cervix length. Everything looks great. They cannot find any issues. So that was really, really good to hear. He doesn't know why it's happening, but, you know, he said if, you know, unless your symptoms start to get painful or, of course, you see blood or any of those things that would be concerning that we know, pressure, that sort of thing, you're fine. So, you know, take it easy when it happens, hydrate when it happens, but you're fine. So anyways, it was really good to touch base with him and like kind of ease my worries and concerns. Obviously it's just hard to go through something like that when you've had a loss in the past. Every, you know, worst possible outcome is going through your head, and it's just super, super scary. So last week I was just, you know, I was physically drained from all the contractions. I was emotionally and mentally drained. It was a difficult week. But I'm very happy to say that this week the contractions have really subsided. I still have a decent amount of that cervix pain, but you know, it is what it is. Now I know it's not concerning because my cervix length is fine. So we'll just keep an eye on things, and I go back in, I guess it's next week at this point, now that I'm looking at the date. So I go back next week and I'll touch base with my specialist again and my regular OB. And so we'll just keep an eye on things. Next week also marks the week that I have to up my injections for antiphospholipid syndrome to twice a day. So I do them in my stomach. Right now I do them once at night every single day. And it's just hard. I mean, it's hard. There's no other way to put it. They hurt. It's hard. So now I have to do it twice a day, once in the morning, once at night. So that's going to be kind of a hard mental shift. But it is what it is, and I'm trying to power through and just focus on the good that it is doing for the baby, for William. But I'm ready to be done with those. So I have my eye on like getting to 35 weeks. I'm also very itchy at times from, I'm guessing, cholestasis. They are monitoring me very closely for that, but since I had it with Caroline, I'm highly likely, it sounds like, to have it again. So at times I get very itchy, but it's not consistent yet, so they're not worried yet, but it's there. So I get worried about that too, because that's an extremely high risk of stillbirth. So just, you know, it's just another thing in the back of my mind. So we're keeping an eye on it. I'm just keeping communication open with my doctor about that. But odds are they're going to want this baby out around 35, 37 weeks for that reason as well, which is scary in and of itself, but I will be ready at that point to make sure that he's out and healthy and that nothing happens. So anyways, so that's the big stuff. It was a big week, I guess, with regards to pregnancy stuff. But we're hanging in there and things have kind of mellowed out. So this week has been much better as I go into my 23rd week. So things are evening out a little bit. So hopefully that continues to happen. And I think that's all of my updates this time.